So today I'm going to be assisting you with filling out some of your medical forms. Okay. Okay, and it was just the one that you need in order to participate in sports, is that right? Okay, let's see if I have the correct form. Now, can you just remind me which organization will you be participating in? Okay. Yeah, each one has a little bit of a different form. They're all very similar, but you want to make sure you have the right one. Let's see. Now, let's see, what is the date on this one? Let me make sure there's not an updated version here. Alright, this must be the one that we need. Okay. Alright. So most of this is a questionnaire, but some of it is an actual physical exam, and I can fill that out after your exam is completed, okay? Alright, let me sit down. Alright, let's see. Are you comfortable there? Alright. So let me see. This might be some duplicate information here on these, but we'll see. So let's see, today's date. And this has to be done within the past 6 months, I believe. Okay, so make sure you hand this in promptly. Let's see. All right, name. Okay, and that's A-R-E. Okay, and your date of birth. Okay, and your age. Okay, and your grade level. And your school. Okay, and again, which sport or sports are you planning on participating in? Okay. Alright, so this is in the fall and winter, is that right? And this one is for the spring season, correct? Alright, you just have to make sure that this form and this exam will not expire before the spring session, okay? Alright, so let's see, medicine and allergies. Are you currently taking any prescription or over-the-counter medicines or supplements, and that can be any kind of herbal or any nutritional supplement that you're taking. Okay, take a multivitamin. And do you happen to know any of these specifics? Do you know the brand? Okay. And how often do you take that? All right. Do you have any allergies? Okay. Allergy to medication? To pollens? Any foods? Stinging insects? All right. All right. All right, now these are some general questions. If you don't know the answer, that's fine. Just let me know. Has a doctor ever denied or restricted your participation in sports for any reason? Okay. Do you have any ongoing medical conditions, such as asthma, anemia, diabetes, any other infections? Okay. So that was in the past. And when was the last time you were treated for that? As a child? Okay. Alright, but not currently? Okay. Have you ever spent the night in the hospital? Not that you know. Okay. Have you ever had any surgeries? Okay. Have you ever passed out or nearly passed out during or after exercise? No. Have you ever had any discomfort, like pain, tightness, or pressure in your chest during exercise? No. Okay. Other than muscle pain, of course. Alright, does your heart ever race or skip beats during exercise? Yes, that would be something you would have a sensation of, like an irregular heartbeat. Not that you know. Okay. Have you ever been told by a doctor that you have any heart problems? Okay, well, that can include things like high blood pressure, high cholesterol, a heart murmur, any infections, vascular disorders. No. All right. Has a doctor ever ordered a test for your heart, like an EKG or an echocardiogram? That could have been for an acute problem or issue, or it could have just been a routine exam. No. Okay. Do you ever get lightheaded or feel more short of breath than expected during exercise? Okay. Have you ever had an unexplained seizure? No. Do you get more tired or short of breath more quickly than your friends or anyone else participating in a sporting event or during exercise? Okay. Alright, now these questions are more about your family history, okay? Has any family member or relative of yours died of any heart problems or had an unexpected or unexplained sudden death before the age of 50? Okay. Does anyone in your family have hypertrophic cardiomyopathy, Marfan syndrome, a arrhythmogenic right ventricular cardiomyopathy. I know these are very complex medical issues that you might not have the answers to. Long QT syndrome. This is an issue with your heart rhythm. Short QT syndrome. Tachycardia. Okay. Does anyone in your family have a heart problem, a pacemaker that you know of, or an implanted defibrillator? You don't know. Okay. Has anyone in your family had any unexplained fainting or seizures? No. Okay, now these questions are about your bone and joint health. Have you ever had an injury to a bone, muscle, ligament, or tendon that caused you to miss practice or a game? Okay, and when was this? Alright, let's see, 17. So this was when you were how old? Okay, and how did that injury happen? Okay, and what type of care did you receive for that injury? You had it cast. Okay. Have you ever had any broken or fractured bones or dislocated joints? And that would be yes. Have you ever had an injury that required x-rays, MRI, CAT scan, injections, therapy, a brace, a cast, or crutches? Have you ever had a stress fracture? No, that would be different than this. Okay. Have you ever been told that you have, or have you had an x-ray for neck instability? Okay. Do you regularly use a brace, orthotics, or other assistive devices? Do you have bone, muscle, or joint injury that bothers you? No. Do any of your joints become painful, swollen, feel warm, or look red? No. Yes, other than if something is causing it, obviously, to look or feel that way. Okay. Do you have any history of juvenile arthritis or a connective tissue disease? Okay, some more medical questions here. Do you cough, wheeze, or have difficulty breathing during or after exercise? Have you ever used an inhaler or taken asthma medicine? Okay, that was number 27. And that was when you were a child, right? Okay. Is there anyone in your family who has asthma? Okay. Were you born without, or are you missing a kidney, an eye, spleen, or any other organ? Okay. Let's see. Do you have any chronic pain? Have you ever had mono or infectious mononucleosis within the past month? Okay. This one here. Do you have any rashes, pressure sores, or any other skin or dermatological problems? No. Alright, have you had any other skin infections? No. Have you ever had a head injury or a concussion? You don't remember. Okay, we'll go with no. Have you ever had a hit or a blow to the head that caused confusion, prolonged headache, or memory problems? Okay. Do you have a history of seizure disorder? No. Do you have headaches with exercise? Have you ever had numbness, tingling, or weakness in your arms or legs after being hit or falling? Have you ever been unable to move your arms or legs after falling or being hit? Yes, that could be with any type of sports equipment or another person during a game. All right. Have you ever become ill while exercising in the heat? All right. Do you get frequent muscle cramps when exercising? Okay. Do you or someone in your family have sickle cell trait or disease? Okay. Have you had any problems with your eyes or vision? And we will be doing a full exam on you for that as well. Have you ever had any eye injuries? Okay. Do you wear glasses or contact lenses? Okay. Do you wear protective eyewear such as goggles or a face shield? Okay. Let's see. Do you worry about your weight? No. Are you trying to, or has anyone recommended that you gain or lose weight? Okay. Are you on any special diet, or do you avoid certain types of foods? Okay. Have you ever had an eating disorder? Do you have any concerns that you would like to discuss with your doctor? All right. Okay. This is for females. All right, so I will let me sign here. And today's date again. Okay. So let me see. So this continues here. Alright, so this part is for the actual physical exam, so I will be able to fill this part out on my own. Okay. Let's see, that's this one. This one is for you to take with you. And let's see, these are some more medical questions here. Some of these, like I said, may be duplicate. Okay, can you remind me your date of birth? Alright, so let's see, this one has very similar questions. And again, the physical exam form. So it looks like I just need to go through this front page here and this here, and the rest will be for me to fill out after your exam, okay? Alright, we're almost done here. Alright, so let's see. Some more general questions. Any acute or chronic infections? No. Fever, chest infection, or have you ever had untreated tuberculosis? Okay. And you already said no to any implantable device. This one asks specifically for any implantable device which can alter physiologic processes or enhance performance. No. Now, as for your vision, as I said, I will do a full assessment on you. Have you had any refractive, such as LASIK and or any intraocular surgery, like for cataract or retinal detachment? Okay. Let's see, your visual acuity, we will assess that together. And alright, do you have any history of COPD or uncontrolled asthma? Alright, just the history of asthma in the past. Alright. How about any history of pulmonary hypertension? Okay. How about aortic or pulmonary valve stenosis? Okay, let's go to this section here. Any history of myocarditis or pericarditis? Any history of any arrhythmias like third-degree heart block? Any atrial or ventricular tachycardia? Any coarctation of the aorta or any aortic aneurysm? Okay. Any unclosed significant patent ductus arteriosus? These are very specific. Ablation or surgical correction procedures that will require medical clearance and release by a cardiothoracic surgeon to return to sports. Okay, your resting blood pressure more than this history of poor control. We will assess that together, but you don't have any history of hypertension. Okay. Hematology, any history of sickle cell disease? Severe blood dyscrasias and or clotting disorders. Okay. Ongoing therapeutic anticoagulation. Alright, gastrointestinal, any issues with your gastrointestinal functions, any infections, digestive issues? No. Okay, endocrine, no history of diabetes or uncontrolled thyroid disease. Okay. History of any hepatitis B, C, or HIV. Skin, no infected open lesions, no history of herpes, MRSA, impetigo, or any untreated fungal infections. No. All right. No history of seizures. No. Okay. Any unresolved post-concussion symptoms? Have you ever had any stoppage of any athletic event or a diagnosis of concussion within the past 2 weeks? Okay, musculoskeletal, no. Recent fractures, injuries, no. Okay, no recent changes in your ambulatory function, no weakness, no neurological symptoms, no changes. Okay. All right, this is, let's see, do we need this apart? All right. I think we just have a few more questions. Have you ever had any surgeries? Okay. No stays in the hospital, you said. Is your doctor currently treating you for anything? No. Not including any just routine physical exams. Are you being treated for something specific? Okay. Have you ever been unconscious or had a concussion? No suspected or no, okay. Have you ever been hit hard in the head in the last 6 weeks? No. Okay. Have you had any of the following symptoms over the past 2 weeks? Persistent headaches, ringing in the ears, or blurry vision? Okay. Does any significant disease run in your family? Okay. Are you currently taking any medications? Okay. Do you have any significant hearing loss? Do you have or have you ever had a hernia? Do you wear any braces or a retainer? Do you have any implants? Let's see. Inhalers? No. No insulin to treat diabetes. And let's see. No episodes of chest pain or palpitations, right? Okay. Alright, so all of the rest of this looks like it's for us to fill out with your physical exam. Alright, so I am going to do just a very quick assessment, just the basics. Okay, that's all that's required for this evaluation. Okay, so let's see here. Don't need too much, I think. Just to get up blood pressure. I don't think we need a sugar. We'll get a pulse ox, though you're not having any issues with breathing at the moment, right? Good. I just need this, okay. Let's see here. I think first I'll just get a quick assessment of your eyes, okay? Alright, so just look straight ahead. Alright, I'm just having a look. Okay, can you open and close? Okay, open and close. Okay, very good. Okay, good. Alright, so can you just pick a point on the back wall and just look straight ahead? Okay, that's good. Just keep looking straight ahead. Yes, you can blink if you need to. Let me see. Let me just look down here. No redness. And you're not having any issues with your eyes, right? Okay, and when was the last time you had your eyesight vision checked? Okay. Okay, well that looks good. We can do a vision check as well if needed. Okay, just to open your mouth, please. Okay, stick out your tongue. Good. Okay, can you put your tongue to the left and to the right and up to the roof of your mouth? Okay. See? There we go. Very good. Okay. Let's see. Going to just check your oxygen level. Okay, just put this right on your finger. Right there is good. Okay, good. We've got 99. And let's see, I'm going to take a quick listen. Alright, good. So now just take a nice deep breath in and out. Good. Deep breath. Okay, good. Okay, in. Okay. And one more time. come forward just a bit. So I'm going to listen on your back. And you can just breathe normally here. Okay, good. Okay. I hope you can just continue to breathe normally. Okay. Everything sounds nice and clear. Okay, good. And just take a quick listen to your heart, so just breathe normally. Okay, great. Everything is sounding perfect. Alright, we're going to get a quick blood pressure. Good. Let's see this arm here. All right, good. Okay, so just relax. Okay, perfect. 109/68. Alright, so I think that's everything for today. That's all that's required. So let me just make sure all of your paperwork is all filled out and you'll be good to go. Okay. Looks like this is all complete. So, would you like for me to put these in an envelope for you? Okay. Alright, so let me fold this one up for you, if that's okay. Okay, that's one. This one also. Yeah, so I would recommend making a copy of this for yourself. If you need, we can make some copies for you up at the front desk, but you know, just try and make sure you make some copies. And for your own records, of course, we will have some on file here if you need. And trying to get these in, handed in as soon as possible, okay? Keep them in a secure place. There's a lot of your personal information on here. Alright, so this is for you. Is there anything else that I can help you with today? Okay, well, all of my contact information is here. If you need anything, you just give the office a call and we'll help you out, okay? Alright, good luck and see you next time.